be able to access it. You should be able to access it on our website. So as the presentation is going, we're going to go let our presenters do their whole presentation. And then I know when someone is talking and you come up with a question, sometimes it's hard to keep that question in your mind. So please feel free to go ahead and use the Q&A. You'll find the Q&A at the bottom of your screen. It's got two little message bubbles, just like the chat, but you won't be able to key into the chat today. It's much easier for us to manage the Q&A. So any questions that you have, drop them into the Q&A, and we will be moderating those questions and reading them out to our presenters, our subject matter experts. So let me introduce to you our presenters for today. So our topic this month is effective communication with deaf and hard of hearing and the deaf community. So today we have with us Ms. Brenda Lusk Freeman and Ivy Williams. So Brenda Freeman is a deaf services specialist with the North Carolina Division of Services for the Deaf and Hard of Hearing in the Charlotte Region Center. She's been there for 18 years, lots of experience. She is a native of Davidson County, North Carolina. She graduated from North Carolina School for the Deaf in 1984 and Gallaudet University, I hope I didn't butcher that too bad, Gallaudet University in 1990. She works around 10 counties helping agencies and deaf-blind clients around Charlotte, helping educate them about deaf, hard of hearing, and the deaf-blind communities and resources on accessibility. And then we also have Ivy Williams. So Ivy is the Hard of Hearing Services Specialist with the North Carolina Division of Services for Deaf and Hard of Hearing, also the Charlotte Region Center. And so as a deaf hearing services specialist, Ivy's mission is to ensure all North Carolinians with hearing loss have effective communication in all aspects of their lives. In doing so, services she provides include, but they're not limited to, advocacy, outreach, technology, consultations, information, and referral. Ivy earned her BS in psychology from North Carolina A&T University and her MS in rehabilitation psychology from the University of Wisconsin-Madison. So join me in giving a warm welcome to Ivy Williams and Brenda Freeman. And if you just hold just a minute, Beth is going to share the slide deck and we'll let you all take it from there.
Great. Can I begin now? Awesome.
Absolutely.
Thank you for that warm introduction, Anne. Brenda and I will share the presentation this afternoon. I will take the first half and Brenda will take the second half. So we both work for the North Carolina Division of Services for the Deaf and Hard of Hearing. Our agency is a state agency. We have offices located throughout North Carolina. We do serve three primary groups of individuals. So we do serve those who are hard of hearing, those who are deaf, and also those who are deaf-blind. And so my portion of the presentation will focus mainly on hearing loss signs, the impact of hearing loss, and also communication tips when communicating with those with hearing loss. And then Brenda will focus on the deaf community, how to work with the deaf community, how to hire an interpreter, and she will also give you more information about our agency and what we do. Next slide, please. So why is it so important to understand the hearing loss community? Well, this is why, because out of our population in North Carolina being roughly 10 million, out of that 10 million, roughly 1 million have some degree of hearing loss. And as you can see, these numbers were collected in 2019. So it would be safe to say that it would be even higher now in 2023. The number of individuals with hearing loss is expected to increase throughout the years. As you can see, when you break down the number of individuals with hearing loss based on age, the majority of individuals with hearing loss are older, 75 and older. And then lastly, hearing loss is growing also among veterans. As a matter of fact, hearing loss and tinnitus, which is the ringing or the noise that one may hear in their ears that others cannot hear, those are the top 2 disabling conditions among men and women returning from combat. Okay, next slide, please. So here I would like to break down the different definitions of hearing loss. So when I say hard of hearing, generally what this means is this group of individuals do rely on their residual hearing to communicate. And many individuals who are hard of hearing also do rely on some form of technology, such as hearing aids or cochlear implants, or some type of assistive technology to communicate as well. The second group are those who are deaf. Generally, individuals who consider themselves deaf usually lose their hearing prior to acquiring speech. Generally, this group of individuals rely on American Sign Language to communicate. That is typically their first language. And then also, to be a member of the deaf community is also to be part of a culture, because individuals within this group, they have that shared language, they have shared values. They tend to go to the same social deaf functions as well. Next are those who are late deafened. So people who are late deafened, generally, they lost their hearing after they acquired speech. For some individuals, it can be instant, whereas they may have normal hearing one day, go to sleep, wake up, and they have absolutely no hearing. And then our last group of individuals are called deaf-blind. And so when we say deaf-blind, we don't necessarily always mean that they have zero hearing and zero vision, because individuals within this group tend to have varying degrees of both. But there are individuals who are completely deaf and completely blind as well. Next slide, please. So here I would like to talk a little bit about the signs to look out for if you suspect that someone that you're communicating with, or maybe someone that you know, may have a hearing loss, but you're not quite sure. These are some of the common signs that you may see. The first one is very common, is very obvious. If someone is continuously asking you to repeat what you said or say what or hun, that could be a sign that they have a hearing loss. And usually that is accompanied with some of these other signs that you see here. For example, if you've ever asked someone to turn the volume down on their television or their radio because it is uncomfortable for you, that could be another sign that they have a hearing loss. If you're, speaking to someone on the telephone and you can hear their TV blaring through the telephone, it could be a sign that they have a hearing loss. If someone asks you to repeat what you said, that could be another sign. A lot of times people with hearing loss tend to complain that others are mumbling or others are not speaking loud enough. And so generally what they're tending to do here is placing the blame on someone else for the reason why they are not able to hear or understand. Difficulty speaking in groups, because a lot of times in group situations, people may talk over each other and sometimes the topic of conversation can change. And for someone with a hearing loss, it's very, very difficult to follow the conversation if there are several people talking all at the same time. Difficulty talking on the phone is another one. Usually when people have a hearing loss, the first thing that they complain about is how hard it is to communicate on the telephone. Another big one is the social interactions. Unfortunately, people with hearing loss tend to isolate. And the main reason for that is because it is difficult to understand in group situations. So whenever you are in a group situation and you're just not really sure what people are saying, it's hard to follow the conversation. It can make, someone feel left out, and, and it can make them feel uncomfortable. So it's easier to stay home. It's easier not to go to the senior center or to church or various family gatherings because of that difficulty with conversating. Dominating the conversation or speaking too loud. So a lot of times people with hearing loss, they can't hear the volume level of their own voice. So it may appear they are shouting at you, or oppositely, they could be not speaking loud enough. Or dominating the conversation is when you can't get a word in because the person with hearing loss keeps talking and talking and talking and talking. And you know what that is that, well, if they're the one talking and talking and talking, then they don't have to worry about following the conversation. They don't have to worry about what someone else is saying or asking someone to repeat, or did the topic change, because they're the only ones talking. Interrupting is a big one. Bluffing is another big one. Bluffing is when someone pretends they may have understood what you said by smiling like this or nodding, hoping that kind of buys them some time, and hoping that you don't realize that they missed what you said. Because a lot of times people with hearing loss, they don't want to feel like they're a burden onto someone else. So they don't want to ask you over and over to repeat what you said or say it a different way. So they'll bluff. I think, we all may be guilty of bluffing at some point in our lives, but people with hearing loss tend to do this more so. Jokes about age, or just, they'll blame I'm just forgetful today, and not really want to admit that they do have a hearing loss. Or maybe when they responded to something that you said, their responses were off topic, or maybe their responses were inappropriate. So these are all signs that someone could have a hearing loss. Someone may have one of these signs, they may have several of these signs. Okay, next slide, please. So one of the things I do want to cover is the impact that hearing loss has on a person's quality of life. Because a lot of times, hearing loss is not discussed, and we don't understand the true impact that it can have on someone's life. Generally, hearing loss is not painful. Hearing loss is not life-threatening. So a lot of times it kind of gets placed on the back burner. But I want to go into more detail about the true impact of it. So what you see here is a picture of an iceberg. You see the tip of the iceberg there. This tip of the iceberg, this represents hearing loss on the surface level. Okay, next slide, please. So these words that you see here, all of these words, and this is not even all of them, these represent the impact that a hearing loss can have on a person's quality of life. This is what we don't see. These are the things that we don't talk about. For example, let's just take independence. For those who acquire hearing loss, unfortunately, they lose a lot of the independence that they may have once been accustomed to. For example, I mentioned earlier that it's harder to hear on the telephone. For someone with a hearing loss, now they may have to rely on their spouse or on their adult children to call their doctor and to schedule their next appointment because they can't hear and understand on the telephone. I spoke briefly about the social isolation factor. And we all know that human beings, we're social creatures. We need other people. We need to be with other people. But when we self-isolate and we stop going to those social gatherings that we once enjoyed going to, that can take a toll on our mental health as well. And then the last one I want to touch on is the relationships. A lot of times people don't realize the impact of a hearing loss can have on the relationship. Usually the individuals who are closest to the person with the hearing loss are the ones who are impacted the most. The hearing loss doesn't just only impact the person with the hearing loss. It impacts every single individual that they come in contact with. So it does take a toll on the relationship because it is very frustrating for a spouse to have to repeat themselves over and over and over again because their spouse may not have understood or heard what they said. And it's equally as frustrating for the person with the hearing loss to not understand or to feel like they're a burden on someone because they can't, fully comprehend the conversation. Okay, so next slide, please. Before I turn the presentation over to Brenda, I do want to focus a little bit on some of the communication tips. So whenever you're communicating with someone with the hearing loss, you can use these tips. And this doesn't, this can go for people who are deaf or hard of hearing. These tips are universal. I will say that this slide here was developed for a healthcare setting, but you can take this information and really use it in any setting that you're in. So both individuals who are in the conversation, and we'll just say there are two individuals, the person with the hearing loss and whomever they're speaking with, both individuals has a responsibility and to ensure that there is effective communication for everyone. So the person with the hearing loss, they first have to disclose that they have a hearing loss. So many people are reluctant to admit that they have a hearing loss. And so when someone is reluctant to say that they have a hearing loss, whomever they're speaking with can't adapt, they can't pivot, they can't provide accommodations because they don't know about it. So the first responsibility is to disclose it. And then once it has been disclosed that someone has a hearing loss, then whomever they're speaking with, the provider or whomever, has to ask them what their needs are. What can I do to ensure that you have effective communication? The person with the hearing loss can be very specific about their needs, whereas the provider, whomever they're speaking with, can provide those accommodations. It's always important for the person with the hearing loss to reinforce the speaker, because that allows the speaker to continue doing what they're doing if it's working, or to change and maybe try something different if whatever they're doing is not working. So whenever you're speaking with someone with hearing loss, it's important that you pick a quiet area, as quiet as possible, well lit, but not too much light, away from as much background noise as possible, because background noise will interfere with someone's ability to hear and understand. It's important to, when you're speaking with someone that has a hearing loss, to make sure your face is visible. Make sure that they can see your gestures, your facial expressions. All of that assists with communication, because people with hearing loss do rely on speech reading. We all do to some degree, but those with hearing loss rely on it even more so. They need to see your facial expressions. They need to see your gestures, the movement of your mouth. All of that helps with communication. It's very important when someone discloses when they did not understand what the speaker said. Therefore, that allows the speaker to repeat or rephrase, say it a different way, or clarify what the person may or may not have heard. Next slide, please. So continuing on, again, making sure that the area, the environment wherever the conversation or the meeting is as quiet and as free of background noises as possible. When in doubt, you can always provide very important information in writing. So not all accommodations have to be expensive. You can get a pen and a notepad or a dry erase board and write something that's very important that you want to ensure that whomever you're speaking with has received that information. So I know we're not using mask as much now as we did a year or two ago, but if you are ever to wear a mask, it is very important that you wear a clear mask, because people with hearing loss still, they need to see your mouth, they need to see your facial expression. So when you have a mask covering up half of your face, that eliminates a lot of the ability to communicate and to understand as well. There's a lot of technology now that someone can utilize. There's a lot of apps that someone can download on their phones. We call those speech to text apps, which will essentially transcribe voice and translate it essentially to speech so that someone is able to read what you are saying to them. And then there's various types of equipment such as personal amplifiers that someone with a hearing loss can also utilize as well. Okay, so with that, I am now going to turn this presentation over to Brenda, and she will go over more information about communicating with the deaf community.
Right, next slide, please. All right, hello everyone. My name is Brenda Freeman. I'm happy that you're all here today. Now we're going to talk about why it matters. So when you are looking at people out in the community, you might be able to spot that there's someone and you might think, okay, they look like they're hearing, but they're actually deaf or hard of hearing. It's what we call a hidden disability. I am deaf. Oftentimes people will think I'm hearing. They'll assume because I don't have a hearing aid that I am hearing. Maybe they don't see a cochlear implant, but that can also be hidden by your hair. So when they look at me, they just assume that I'm quote unquote normal. So just kind of keep that in mind whenever you're out and about in the community. Be aware that there are some people who have hearing loss. And the goal is effective communication. Now, Ivy did mention this. So for those who are deaf, most of them were either born deaf or they became ill and they lost their hearing at that time when they were young and learned how to sign. There are a variety of communication styles. So in my time, once you were identified as deaf, you were sent to a deaf school. There's a deaf school in Morganton. In 2023, they have the newborn hearing tests, and once babies are born, they automatically get that testing, so they know instantly whether the child needs to have speech therapy, if they need to learn sign language, and this is a decision that parents make for their children. Ivy had just put a message down. Okay. All right. So I have a twin sister. She is hard of hearing. She was born hearing, and then later on in life, probably around 11 or so. As most of you know, those who are hard of hearing, they tend to speak for themselves. Some can speak fairly well. And some hard of hearing individuals know sign language in addition to be able to speak for themselves. It does depend on how they were raised. Some people don't know sign language, even if they're hard of hearing. Some hard of hearing individuals I know, they don't know sign language. There is one individual that I know who was hearing, and then when they were 25 years old, all of a sudden they lost their hearing. Sometimes it happens in car accidents, farming accidents, sporting accidents, domestic violence instances can cause someone to become hard of hearing or deaf. So there is a variety out there that you'll see. And again, for those who are deafblind, that is probably the most challenging of all. And the reason is because both of those senses, both your vision and your hearing, has to some degree been lost. And as Ivy had mentioned, there is a degree of hearing or vision loss. There are those who, if they were born deaf and blind, they use what's called tactile. So it's hand on hand. For those who are hearing and then later on in life, they become deaf. And then, or if they're hard of hearing and become blind, they might focus more on using Braille and a little bit of tactile. Maybe they are able to speak for themselves, but they also may or may not be dependent on technology. In my class of 1984, I want to say there was probably, of all those who graduated with me, there were those who were already deaf-blind. So there was about 20 in my graduating class. We had some individuals who had hearing loss, but then the vision loss came from either diabetes or just as they got a little bit older, their vision began to go. So again, there's some variation within there. Next slide, please. It's important for you to be mindful of the Americans with Disability Act, the ADA, as you are the front line working with individuals who have disabilities. You need to be mindful of this. So Title II is for state and local government agencies. Title III is for public accommodations. And so that might be something that you will find within your organization, that access has to be provided for all individuals, not just for those who are hearing. It has to be available for those who have varying levels of disabilities. So everyone has access and everyone is treated the same and has the same access to the same services. So if you're providing services to someone who is hearing, you should be able to provide the same service to those who have hearing loss. And one way to do that is to provide an accommodation. So please do not discriminate against those. So the key thing is access for all. So that's for people who have disabilities and those who don't. Next slide. As you can see on this slide, we have some labels and we have a big red slash through them. One thing that we see is hearing impaired, deaf and dumb, deaf mute, and handicapped. Please, please avoid using these words, these terms. You can say someone has a hearing loss. You can say they're deaf. You can say they're hard of hearing, they're deaf or blind. Those are the polite ways to say it. These are the more archaic terms. That's words that have been used in the past. And if you do use these, it can be an insult to that individual. They might get angry and mad because they aren't dumb. They have feelings and they can communicate. They just communicate in a different way. If somebody was, if someone didn't have an arm or a leg or something like that, they would still be upset if you were insulting them in some manner. So this is just something that we want to emphasize, that please avoid these labels. Next slide. Now, oftentimes people will envision stereotypes of what deaf people or disability looks like. So each person is different and they have a different background, they have a different way that they were raised, which schools that they went to, the social class that they grew up in. There's a lot of variety within there. So again, don't stereotype someone that you just met. Sometimes people will think, oh, you're one deaf person that I've met. you must be like all the other deaf individuals. So deaf people are just like anyone else. Some deaf people can do things, some deaf people can't do things. One stereotype that or myth that we commonly see is that people will think that deaf people can't drive. And again, that's something that I would like to refute. Deaf people can drive. We just keep our eyes on the road. It's very important that you look at your rear view mirror and you keep your eyes on the road. And research has actually shown that deaf drivers are actually safer drivers than hearing drivers. So some deaf people can drive and some don't, of course. You do have to pass the test at the DMV. And that's just like anyone else who's wanting to get their driver's license, hearing or deaf. For those who are deaf and deafblind, some people think that they both automatically know how to read Braille. That's not always true. So for those who are deafblind, there are some people who, when they were born fully deafblind, that they went to a special government school. So one example would be the Governor Moorhead School, and where they got training and learned how to read Braille. So that would be one instance where they can read Braille. For those who were born hearing, and then later on in life became blind, and then later on even trying to learn Braille, that might be something that they were able to do, or they might not have been able to pick that skill up. So for anybody who thinks that sign language is universal, that you can use it in any country around the world, it is not. Each country has its own sign language. Here in America, we have those who use Native American Sign Language. That is something that was here before any settlers came. And then in ASL, American Sign Language, is something that is commonly used in other countries. Like, for example, England, they have BSL, British Sign Language, Spanish Sign Language. Each country has their own sign language. So if we are going on an international trip, there is an international deaf conference. They do use what's called universal sign language there, and that's to kind of be able to communicate with each other on that plane. Another myth is that lip reading is a good accommodation. Some people think that just because someone is deaf and can lip read, that they're catching everything. Some deaf individuals can lip read, some can't. One thing to remember is that you can only get about 20 to 30% of comprehension based off lip reading itself. So 50 and 15, those two numbers look very similar on the lips. So it's very confusing. Sun and the sun, like sunshine, it has the same look on the mouth. So you have to be very careful with that assumption. Some individuals think that hearing aids and cochlear implants can restore hearing loss, and that is not true. Hearing aids and cochlear implants are merely a tool, and that tool can be used to help communicate better, but it takes years and a lot of training to be able to identify specific sounds. I did used to wear a hearing aid, but I wasn't able to understand words. Another myth is that deaf people can't hear music. And that's not true either. Some deaf people do love music. They will crank up the music all the way, and they will put their hands on the stereo and they can feel the vibration of the music. There are also some technology that has come out. There's one that's a vest that you can wear that will link up with the music and you can feel the vibrations. Some people think that deaf people are genetically inclined to have deaf children, and that is not exactly true. Only about 10% of those who are deaf are born to the deaf family. So that means that we have 90% of deaf children who are born to hearing family. So I myself have 2 daughters and they are both hearing. Another myth is that deaf people are quiet. And some are very loud. Some deaf people are very loud. They'll bang on tables, they'll yell. That's how they kind of show their feelings and emotions. They sign very large, they clap their hands. They're just very noisy and loud. So for me, for example, if I'm in the kitchen, if I'm washing dishes or I'm cooking, I will be banging all of the cupboards and cabinets. And it's only until someone tells me, why are you being so loud, that I remember I need to take it a little easier and be a little quiet in the kitchen. Next slide, please. All right, next slide. Yes, keep going. You can keep going until we see all of the points. Okay, perfect. So some people will think, oh, there we go. Some people will think that ASL, American Sign Language, is something that has been set up for, it has been set up for over 200 years. It was established in Connecticut. And at that time, they didn't have a school for the deaf. And so they decided to establish a school. And the very first school was in Connecticut. And from there, it spread throughout the United States. And the very last state to have a deaf school was actually Mississippi. So American Sign Language is part of a visual language, and it uses your hands, it uses facial expressions, body language. American Sign Language is not English, it is separate. It is not there is no written form of American Sign Language. A lot of people think American Sign Language is basically broken English. However, it is its own separate language. It has its own grammar, syntax. So one example would be if I was saying I'm going to the store. So that is how it looks in English. I am going to the store. But in ASL, it's merely going to the store. Or in English, if I'm saying, do you need help? In ASL, I would just say, need help? How can I help you? So you can see that based off how my eyebrows go up. All right, next slide. All right, we're going to hold on to this one. Okay. All right, so you might think, how can you get the attention of someone who has hearing loss? They can't hear you and you're going to talk to them. How else are you going to grab their attention? So one thing you can do is you can wave your hands like this. Or you can softly tap someone on the shoulder. Make sure that you don't do it too hard. Make sure you do it nice and soft. If you do it hard, that indicates that it's an emergency. So please remember, if you're tapping someone, to do it softly. Another way would be using the light. So you can turn the lights on and off. If it's at night, if you're in a dark place, you can use a flashlight. And if you're trying to communicate, for instance, and you know that that individual likes to lip read, what you can do is you can actually put the flashlight kind of up towards your face so that they can see your face better. If you're sitting down and you're waving and you're not able to get someone's attention, you can stomp your feet and they'll be able to feel the vibration in the floor and look up to see where that sound is coming from. Sometimes if you feel air, that's another way to indicate that there's something going on. And deaf people will kind of look to see where that airflow is coming from. If you're in a restaurant or a cafeteria and you're across the room, across the table, farther away, you can use the table and tap the table or just use your best judgment. If you're in a restaurant, if you're pounding on the table, you probably have noticed if you've ever seen deaf individuals, they'll be kind of stomping on the floor and pounding on the table. I've been guilty of doing that myself. Next slide. I strongly encourage all agencies, including yours, to establish what's called a communication kit. So it would just be a box that you have for anyone who has a hearing loss, a vision loss, who shows up to your agency. And if they ask for an accommodation, you'll have everything in that box ready to go. So one thing would be pen and paper. Now, for those who are deaf blind, and if they do have some vision left, make sure that you're using a black marker when you're writing and use capital or very large print letters. You can use a dry erase board, and you can use that to communicate back and forth because it's reusable. A communication board, that might be something that you can use also using your cell phone or laptop or computer to write notes back and forth. That would be one way. If it's an emergency, you can use that. If it's something like giving a diagnosis, job interviews, something of a more serious nature, it would be better to provide an interpreter in person. And again, that's for effective communication to make sure there are no misunderstandings that are happening. If you are trying to educate somebody on a medication, for example, and they're not educated and they don't understand the proper way to take their medication, they could go home and they could overdose, or they could have an issue and they could die because they misunderstood. And I'm happy to say that a lot of smartphones have so many different apps that help with communication. So for example, one is Live Transcribe. There's speech to text. There's a lot of different apps that can be used, which are really, really neat. In Japan right now, they're actually working on a sign language camera. So it will capture the sign language and it will actually transcribe it into Japanese or English, maybe later on down the road. Also, I would recommend, if you have masks, if you're using masks in your office, have a few clear masks in the communication kit for those who are hard of hearing or those who are deaf and prefer to be able to lip read. I would just ask the individual to what the effective communication style is for them, and they'll tell you what their preferences are, whether that's having an ASL interpreter, which would require a little bit more planning. You would have to call and get an interpreter at least 2 weeks in advance. So I'll show you what a clear mask looks like. Here at DSDHH, we have resources as well. If somebody needs a hearing aid or they need a flashing doorbell with a flashing light to indicate who is at the door, we can refer them and we will take care of that. We have information and resources for those equipment needs. We have business cards. We also have some DSDHH brochures that if you get somebody who comes in, you can refer them to our agency, especially for senior citizens. A lot of senior citizens, they're isolated and it can lead to depression, and we don't want to do this. We don't want to have them isolated. So we can give them the equipment that helps them to be a little bit more independent. A magnifying glass is another tool to include in your communication kit. And it helps specifically for filling out applications. It makes that print a little bit larger for them. So hopefully, if you have this communication kit together, it means that if anybody needs it, you'll be ready to go. And if anybody needs a list of any of this, I would be more than happy to send it. Next slide, please. All right, so who uses interpreting services? If you think about that, you might think, oh, it's only for deaf people, or maybe it's just for somebody who's deaf and blind, or oh, if they use Spanish as their first language, they might need an interpreter. But interpreting services is something that everyone uses. And that's because if they are using another language, how are you going to be able to understand them? It's not just for them to understand you. You have to also be able to understand them. So the best way to make sure everyone is on the same page and understanding is to provide an interpreter. And you have to understand communication is a two-way street. So it's not just that they need it. Again, this is to prevent having any misunderstandings that happen, especially in more higher stakes situations like medical or court. Those are life or death situations where decisions are being made. So a misunderstanding in those settings can lead to someone dying. In international, if someone's from another country and they come here, they're using a foreign language, that's something that's very important as well. Next slide. Now, why should someone hire an interpreter? Now, this is something that an interpreter has had either 2 to 4 years of education, and that's for them to both understand both the sign language piece of it and the English piece of it. They are licensed as well, so don't just bring in anyone. And then I just have one more little thing that I want to go over. The next slide is okay. How to know if an interpreter is qualified. You can ask to see their license and they'll be able to provide that information. So you'll be able to see if they're currently licensed. If a consumer is saying that they don't want an interpreter, you can still provide an interpreter that can prevent them from suing you in the future. If somebody says that they don't understand, or if there's no interpreter, they can say they'll sue you because there was no interpreter provided. Next slide, please. All right, and I know Ivy mentioned her duties, but this is also what our agency does. We have 7 centers, regional centers throughout the state. As you can see, there's Asheville, Morganton, Greensboro, Charlotte, Raleigh, Wilson, and Wilmington. And we serve consumers and organizations, agencies all throughout the state. We do local and federal. Our services are free of cost. We provide free trainings. Next slide. And this is our contact information. So next slide. All right, now is the question and answer portion.
So we have one question. What are more inclusive, respectful terms to use instead of hearing impaired and handicapped, as those terms are most often used in our society still?
Ivy, do you want to answer that or me?
I'll answer it, and Brenda, if you want to add anything, that'll be great. That's actually a really good question. So we tend to try to stay away from using terms such as handicapped or hearing impaired. So if it's, a person with a disability, a general disability, say it's not hearing loss, we just usually say a person with a disability. If they are, someone with a hearing loss, if we know which category or community, we'll say either they're hard of hearing or they're deaf or they're deaf blind. Those are generally acceptable terms that you can use. And then lastly, it's always best just to ask that person, because everyone is different. And, some people may not mind being called hearing impaired. So I would, just ask them what they prefer.
This is Brenda. I would like to add to special needs. Someone might say they have special needs or the specific type of disability that they have. And to be polite, it's not that you're saying it in a negative fashion. You're just saying, they have ADHD or PTSD, they're autistic. It's not like you're labeling them as generic handicapped. Hearing impaired kind of has a negative connotation to it. So just wanted to add that to what Ivy had to say.
Thank you for that answer. The next question is, are your interpreters independent of CAP, Communications Access Partners?
I'll take a stab at it. I guess we're not really sure what CAP is, and I guess that's why you see the hesitancy. But our interpreters are independent. For example, Nolan, she's a contract interpreter. So whenever we have meetings or presentations or staff meetings or whatnot, we will bring in an outside interpreter to interpret our meetings. Now we also have an interpreter position within our division as well. So all 7 regional centers has an interpreter position. Our interpreter position is currently vacant. So I think that answers your questions. Our interpreters are separate from CAP. Brenda wants to add.
Yes, I did want to add. They're independent contractors, freelance interpreters. So they work as interpreters. And then there's also agency interpreters who work for a company. I think there are about 15 interpreter service agencies throughout North Carolina. But we do have interpreters who kind of freelance. They are licensed. If you are wanting some more information about that, you can go to our agency website and see Division Services for the Deaf and Hard of Hearing. And we have a list on there as well, and it has information about sign language interpreters and resources. You can pull that information up and it will show you a list of freelance contractors as well as agencies and businesses. There's also what we call cued speech interpreters. So there's an entire list that has it all broken down.
We have one more question. I currently have a client who is a partner's client and lives in Asheville, North Carolina. I contact CAP to provide interpreters for visits. Can I also contact partners for an interpreter as well?
This is Brenda. If the individual lives in Asheville, then they would need to contact the Asheville Regional Center if they needed something. It depends on the company as well. If they're a larger company, they might be able to provide their own interpreters because they're getting that federal funding. And so again, with the Americans with Disabilities Act, that would be providing an accommodation. So providing an interpreter, or if they had some other accommodation request, that would be covered. Again, if they were in Asheville, there is a freelance interpreting list that they could pull from, or they could contact agencies in that area.
And just to clarify and add, piggyback on what Brenda's saying, so generally, whomever is hosting the event or the meeting is the person responsible for acquiring the interpreter. Our regional center that is in Asheville can provide resources on where to hire that interpreter, but generally whoever's hosting it is the one who has to hire and ultimately fund the interpreter.
Thank you, Ivy. I was going to add that if we hosted an event here at Partners, we would absolutely be responsible to provide an ASL interpreter or to support any accommodations that are needed.
That's correct.
Right. And for example, nursing homes, or maybe family who have deaf senior citizens who need help, they would I've helped them set up interpreters for the first time, so I can walk them through that process. Nursing homes, they would just have to set up like communication boards. They've done that before. Our agency has been working on helping to train some nursing home staff to learn sign language, to be able to communicate with a deaf patient that they have. So it does depend case by case.
We don't have any more questions in the queue.
All right, this has absolutely been wonderful, just great information. Great information for our members and our families, for our staff who work with our members in the community, our frontline staff for sure, which is what we do in member engagement, is work together with the families, help them navigate. So I want to say a big thank you to you all for being here with us as our guest speakers. And then for our audience, I just want to remind you that, the tailored plan is coming soon. It is slated to roll out on April 1st. And I want to invite you all to watch for information about a virtual education series about the tailored health plan and Medicaid direct and state funded services that will begin on January 24th. And we have a flyer ready to go out. It's going to hit email very soon here within the next couple of days. So keep an eye out for that information, and we hope to see you all at those events to learn more about Medicaid transformation. All right, so I think something else might have popped into the Q&A there, Beth.
It's just a comment saying really great and an informative presentation. Thank you.
Great. All right. Well, thank you all.
Thank you for inviting us. Thank you, everyone.
Thank you.
Great.
Thank you.
All right. Thanks for joining us for Member Cafe. We hope to see you next month in February, which is healthy heart, healthy eating is our focus for next month. So we hope to see you next month for Member Cafe, second Tuesday in February. So y'all have a wonderful afternoon, and we hope to see you again soon. Bye-bye.
Bye.